I see the attendees are coming in. It is 11:30, and we just want to make sure that we are cognizant of your time. So we are going to get kicked off here today. My name is Sarah Cosmerl, and I'm a financial advisor with Blue Heron Financial Group. We are based in the Annapolis area, but have the privilege of serving clients all over the country. So we really appreciate you taking the time this morning. We've got a great presentation with Emily as our guest speaker, and just around Medicare and Medical. That conversation has continued to increase on our side with retirement planning. It comes with a lot of consideration. So I'll be taking notes and jotting things down here as well. We want to make sure to thank Northrop Grumman Federal Credit Union for the partnership and helping us to promote this presentation today. This year, we celebrated 25 years, which we are very excited about and grateful for. So without further ado, I'm going to kick this off to Emily O'Halloran with MP Group, and they really focus in Medicare education, which we'll all be going through today, as well as helping with enrollment services. So I do just want to add a housekeeping item. We are not able to take live questions on the air, but if there are any questions, whether general or how it relates to your personal picture, there will be plenty of ways to get in contact with us at the end of this presentation, and we'll make sure to send follow-up as well. So Emily, I'm going to hand this off to you.
All right. Thank you so much, Sarah. I appreciate you all having me again this year. Thank you to Blue Heron and Northrop Grumman Federal Credit Union. Very happy to share what we know about Medicare and what we are learning as current events unfold. And this is what we like to think of as Medicare season. So we'll get into some of that and the details that we think are really important for being ready for this time of year when it comes to Medicare planning. So, we're mainly going to focus on this season, this Medicare annual enrollment period, and we'll touch on the things that are most important to know for this enrollment period. But I will take some time to address some other topics as we move along and touch upon them because of the questions that we are most commonly receiving. While you can't ask questions directly today, we do really know what a lot of those common questions are, so I'll plan to address some of those typical concerns as we proceed. So as Sarah said, I'm the Executive Director of MP Group, and we are an independent Medicare insurance agency providing no-cost education, enrollment, and lifetime support to our clients who are current and future Medicare beneficiaries. So with education being the first in our goals, you can understand that our highest priority is helping people know more about Medicare because we do believe that that is the answer to being less stressed by it. And it's certainly something that we have found is a topic of high stress for people, or at least certainly a sense of just uncertainty, not knowing how things work, how things come together, and what to know or do at different times throughout your Medicare career, if you will. So we love Medicare education. We love helping our clients with all of these things. And again, it's just important to learn as much as possible about Medicare for a successful experience. So these are the states where we are currently licensed. I would imagine that we are covering the area where everyone attending today is a resident. Certainly, if you are in a different area, please reach out to Sarah and we can perhaps connect you with someone in the states that we don't cover. But we're almost there, obviously, a goal of covering all 50 states. All right, so one of the most important things to emphasize going into the Medicare annual enrollment period is just the elephant in the room of how much Medicare communication we will all see. People of all ages are going to see Medicare ads and we're going to hear them. We're going to see things in the mail, and all of this is going to occur with higher frequency over the next few months as we go into the Medicare annual enrollment period, or you'll hear me say AEP for short. And this is a really busy time of year for Medicare. It's a very lucrative time of year for certain insurance companies that are seeking new members. And because of that, what you are mainly seeing is intense Medicare marketing, and it leaves you with certain impressions. One of those impressions is that now is the time to make a change and that you must do something. There's generally a sense of urgency in Medicare messaging this time of year. And while it is important to be aware of deadlines surrounding any enrollment period, this urgency can be a little bit over the top and can tend to make people feel like they're just missing something if they aren't acting in some way. So, what we're going to talk about today will help you understand when you do need to act and when you don't, and what are the triggers for making any changes, as opposed to just this sense of, I should be doing something, but I don't know what it is. Another one of the impressions that is left with this intense Medicare marketing time period is that there are plans or coverage out there that will cost you nothing. They're $0 a month. They'll even give you money back. You'll see ads that say that. And this is something that it's very important to understand is extremely limited to certain eligibility criteria that are based on income. But this isn't something that you'll see or hear in these particular ads or mailings. And we want people to understand that that is a, a, a process that is designed to get you inquiring, but not necessarily something that the majority of people are eligible for. So I hesitate to use the word gimmick. As you can see, I'm really like hanging up on that, but let's just put it out there. It's a bit of a gimmick. And again, it's something that only certain people will qualify for. It's legal to advertise in that way, but it isn't something that applies to most people. And then again, along those lines, you'll see a lot of advertising regarding extras that you can receive with your Medicare healthcare benefits. And some of these extras are incredibly appealing. You'll see advertisements that talk about groceries, gift cards for pharmacy items. You'll even see advertisements that talk about paying utilities and just more cash back and rewards incentives. And these, again, are all things that certain people will be eligible for, but the criteria are very limited. Unfortunately, because this marketing is so ubiquitous, the average consumer thinks if I'm spending anything on my healthcare, I must be doing something wrong because there are all these commercials telling me that there's something out there for zero. So if you've ever been left with that impression that you might be overspending because you're hearing this kind of messaging, you're not alone, and we'll hopefully help you understand that that's really not necessarily what's out there for the average person. So, a lot of disinformation, a lot of misinformation, a lot of marketing oomph, but the devil is in the details, and that's why it's just so important to understand what this enrollment period is, what you can do, what you should be watching for, and how we can help if applicable. Oops, all right. So let's talk about what the Medicare annual enrollment period is, because there's typically some confusion about what is to be done this time of year. So often we'll have folks reaching out to us for the first time because they are either turning 65 in 2026 or they are planning to retire in 2026 or the coming year. People have the impression that because it's the Medicare annual enrollment period, that they might need to be acting this fall for their coverage that they intend to secure next year. And thankfully, that's not the case. So for anyone who is turning 65 or planning to retire past the age of 65 in 2026, the good news is that you'll have your own enrollment period, and that's something that we can help you with assessing, understanding, and planning for. But the Medicare annual enrollment period is a very specific time of year that is for current Medicare beneficiaries. So if you are not currently on Medicare, then you don't have to worry about this enrollment period. Now, if you're here today and you're not currently on Medicare, that's perfectly wonderful, perfectly fine. The things that we're sharing today will apply to next year's Medicare AEP and so on. So it is important to understand that you do not have to act at this time of year unless you are currently on Medicare A and B and you have a reason to act. So again, this is an enrollment period that applies to current Medicare beneficiaries, so no longer on employer coverage or individual plans. Those who have Parts A and B, and then typically either a Part C, which is Medicare Advantage, and or Part D, which is Medicare prescription drug coverage. This is the time of year where individuals who have that type of coverage can evaluate your current coverage, evaluate what's coming for next year, and make changes if you'd like to. No changes required, but this is the time that you can make changes specifically to Part C and Part D plans. So when is the Medicare AEP? Every year, the Medicare annual enrollment period is open from October 15th through December 7th, and any Medicare plan elections for Advantage plans and or prescription drug plans made in that window between October 15th and December 7th will begin on January 1st of the following year. Thankfully, when you make a plan change and it's a Part C Medicare Advantage plan or a Part D prescription drug plan, one of the things that the Social Security system, which is over Medicare, has very well figured out is that when you elect a new plan to begin on January 1st, your current plan will automatically end as of midnight on December 31st. So it's a very smooth process when you do choose to make a plan change during this window. Now, we're here today in late September sharing this information because the window to talk in detail about plans will open next week on October 1st. So anyone involved with Medicare insurance, whether it's an insurance company, a local agent, an independent agent, anyone who offers Medicare insurance coverage can only begin talking about next year's coverage in detail on October 1st, and then applications can go in between October 15th and December 7th. So we're going to give you the general structure of this enrollment period today, and then details will be something that can be addressed in this specific window. So the next most important idea, other than what who this enrollment period applies to and when, is what might you want to watch for changing in your current benefits? And I have to say, this is something that we see so frequently, and I really want to help people to understand that when you are in a current plan year, as much as you may be happy with your coverage, and this is something that's true for all types of coverage, while you may be happy with your coverage, and you might think, well, why would I want to make a change during the enrollment period? Everything's been working great. Don't forget that your coverage that you currently have can be completely different for the coming year. There are a lot of things that can change from one year to the next. So even those members who are currently very happy with their coverage will want to at least be paying attention this time of year and watching for what might be changing to even the coverage that you are convinced you're absolutely 100% satisfied with. So as we are reaching out to our current clients this time of year, and I'm getting a lot of feedback from those current clients, thankfully, I'm getting a ton of messages from clients saying, I don't have any changes, don't need to make any changes, I think I'm all set. And then we're writing back and saying, Hang tight. We still want to make sure that what you have this year is going to be right for you next year because as of October 1st, it may be very different. And we'll want to address that and confirm that everything is as you'd like it going into 2026. So, again, very important message. Even if you're completely satisfied with your current coverage, it's important to be watching for what can change about that coverage each year during this enrollment period. So, what are the things that can change? Well, first of all, Medicare Parts A and B, which we refer to as Original Medicare, and those are the two parts of Medicare that you have as a benefit from the federal government under Social Security. Those parts of Medicare do change every year. The deductibles for Parts A and B go up almost every year. The co-payments, especially on the Part A side, tend to go up every year as well. And certainly we see Part B premiums, and for those people, very few people will pay for Part A, but for those who do not have a long enough work history and who are paying for Part A, that will have a premium that will go up each year as well. So A and B deductibles, co-payments, premiums, um, just benefits in general with A and B can change each year. So this is something to be aware of. You would never want to say, well, I've gotten used to what this deductible is, and I'm just going to plan on it for next year. We have to wait and see what it will be from one year to the next. Now, the parts of Medicare that are coordinated through private insurance companies, which are Medicare Part C or Medicare Advantage plans, or Part D, which are Medicare prescription drug plans, these plans will have changes each year as well. Now, one of the things that is very helpful, I find, to understanding what the drivers are to changes in these plans is to keep in mind the relationship between these private insurance companies and the federal government. So keep in mind that a private insurance company, which are typically for profit, but in some markets you have nonprofit carriers, typically for profit, they are contracting with the federal government to offer Medicare plans. So, in most cases, their intent is to be profitable. And to do that, they have to take into account rising healthcare costs, rising healthcare utilization, which we have seen steadily since the pandemic, and also what the federal government or the Medicare program requires them to cover. And that is something that changes every year. One of the things that we are trying to help as many Medicare members as possible understand, and we do this through newsletters to our clients and educational opportunities, is that from one year to the next, what it takes to partner with the federal government changes. And specifically since the Inflation Reduction Act, we have seen a much bigger burden for coverage um, of costs, of prescription costs, of healthcare costs. We've seen that burden shift from the federal government to these private plans. In other words, it's becoming more challenging to partner with Medicare to offer Part C and D plans. So, what we've seen as a result are more significant changes to these costs that we have listed here. So, for example, you will see going into 2026 rising Part C or Advantage Plan deductibles, as well as a higher Part D or prescription coverage deductible. You'll see higher copayments. You'll see higher monthly premiums, and you'll see some cutting back on benefits. Out-of-pocket maximums will be higher. So this is the amount that the Medicare member on a Part C Medicare Advantage plan will have to spend before the plan takes over completely. And on a Part D plan, we have now out-of-pocket maximums on Part D that did begin in 2025. That amount is increasing for 2026. So this is something that, again, as Medicare shifts responsibility to these plans that want to partner with the federal government, those costs are getting passed along to consumers. These are the ways that we're seeing those costs passed along. Other changes that you will see, again, as impacted by the ability for these insurers to offer their plans, is you'll see changes in the drug formularies or the lists of covered drugs. You'll see changes in the tier that a medication is listed in from 2025 to 2026, and you'll see changes to the copays and the coinsurance on those plans. So, where a medication that you may have had at tier 2 in 2025, perhaps it will be tier 3 or tier 4 in 2026. And that is something that depends from plan to plan and again from year to year. So these are things that you'll want to be on the lookout for and aware of going into 2026. Other changes, and these are things that people will hear about, they'll read about these things in the news. Contracts between major provider networks and plans will be adjusted, and plans will either include new providers in their network. These are the Medicare Advantage or Part C plans, or they may restrict their network more than they did the previous year. So there may be a contract that's ending with a provider group, and those providers would no longer be in the plan for the coming year. That's the type of change that could really impact you if in 2025 all of your doctors are covered. If you're not watching for these types of changes, you may not learn in time that certain doctors you have this year are not covered next year. So, again, this is why it's so important to pay attention to these changes in coverage, even if you're completely happy with how everything is working for you this year. And I'll just note here that the things that I'm sharing on this screen, while I am very specifically talking about Medicare plans, are things that are true about almost all healthcare. So these are things that are true about plans or Affordable Care Act plans. These are things that are true about group employer benefits. In general, we are seeing in this past 1 to 2 years just extreme rising healthcare costs. And so across the board, we're seeing increased premiums, increased out of pocket, and some cutting back on benefits so that these plans can continue to remain active and cover their members. Finally, on this screen, we are are watching for changes to the additional benefits that are included with Part C or Medicare Advantage plans. So, by additional benefits, we mean the plan benefits that are not necessarily direct healthcare benefits. These will be things like allowances or credits for eyeglasses and basic vision care, um, a coverage for hearing exams and hearing aids, coverage for comprehensive dental, fitness or gym memberships, over the counter credits. All of these additional benefits are benefits that these plans are allowed to offer from one year to the next. But as costs are passed to these insurers, and the highest priority is the requirement for these plans to cover the same health care that Medicare would cover, or that original Medicare Parts A and B would cover. In order to do that, unfortunately, often there are years where these plans have to cut back on these additional benefits. Going from 2024 into 2025, we most specifically saw plans cutting back on dental in an extreme way. We don't know exactly yet what changes we'll see going into 2026, but it is something to watch for. So, an example would be if someone is on a Medicare Advantage plan and they're happy with it in 2025 because they had a credit for comprehensive dental, they used it all, and they know they're going to have more dental needs in 2026. You can't assume that you'll have that same credit available to you in 2026. You'll want to be watching to see what your plan will offer next year, and if it's not going to meet your needs, to take a look and see if there's something else out there that would. So these are all of the changes that can occur to the different types of Medicare coverage that are in play this time of year. Now, you may have noticed that one type of Medicare coverage that I have not addressed on this screen is Medicare supplement coverage or Medigap coverage. And for anyone who's here today that's currently on Medicare, you may have A and B as your primary insurance, with a Medicare supplement or Medigap plan as your secondary insurance. And then you would have separate prescription drug coverage. That's a very common, highly recommended Medicare insurance model. So this time of year, you are watching for changes to just that prescription drug coverage because in the majority of states, over 47 states, Medicare supplements are not part of the annual enrollment period. And so that's true throughout the Mid-Atlantic. Medicare supplements will remain the same from one year to the next, as long as you remain enrolled and you don't cancel your coverage. As long as you continue to pay the premiums, you are guaranteed renewable, which means your Medicare supplement plan will keep you enrolled from one year to the next. And upon your renewal date, they will notify you of the monthly premium for the coming year. So if you do currently have a Medicare supplement, your renewal date may in fact be this time of year, and that's just a coincidence. It's either because your 65th birthday happened in the fall or your birthday's in the fall, or because you retired in the fall and that's when you got your supplement. But those are they're throughout the year you can apply for Medicare supplement coverage. You are not guaranteed eligible except in certain circumstances, and that renewal is just ongoing throughout the year depending on your specific date. So again, Medicare supplements are not part of the fall annual enrollment period. A very, very common misunderstanding. We try as hard as we can to educate our clients about this, that they are not something that you can count on being able to choose a new one in the fall, because these annual enrollment period dates and rules do not apply to Medicare supplements. So that can be a trickier topic. If there's anyone who has more questions about that and wants to follow up on that, please do. But it is something that we want to make sure we spread the word that Medicare supplements are not part of annual enrollment period. If you have one, you'll have your own renewal date that could be any time throughout the year. That's when you would potentially see your next increase in monthly premium. All right. So where can you find what these changes are going to be in your coverage? Well, we'll start with the changes to Medicare A and B. So in a couple of slides, I'm going to share with you what some of those estimated changes are for 2026. And then the very best place to follow up to confirm those changes and that these estimates that we have now hold true is to visit Medicare.gov. Medicare.gov is a fantastic website. I can't say enough good things about it. And they do have an app for smartphones. This is the icon for their app. It's just a wonderfully clear, easy to use website where you will get very specific, up-to-date information about Medicare Parts A and B. You can also visit the mpgroup.org website, and there you can sign up for our ongoing quarterly newsletter. We try not to spam anyone. We keep our newsletter as concise as possible. And again, only send it 4 times a year, just focusing on what some of those most timely Medicare updates are and getting those out to everyone who's on our list. But again, at mpgroup.org, you will find more educational materials. And as we have 2026 A and B out-of-pocket amounts and monthly premiums finalized, you'll find that information there. Now, for those of you who are currently on Medicare, and actually for those of you who are here today and you've not yet made that transition over to Medicare, you may or may not be familiar with the income-related charges that are associated with Medicare Parts B and prescription drug plans, or Part D. So if you're new to that idea, I'll just pause and explain that for the last decade and a half, Medicare has applied means testing to monthly premiums for Part B, and then has applied a surcharge based on the same means testing for prescription drug coverage. And so that is something that is automatically adjusted each year once you're enrolled in Medicare. When you are enrolled, and once you're receiving Social Security retirement benefits, you're going to receive this cost of living adjustment letter from Social Security each year in about December. Even when you're not yet receiving retirement benefits, but you are paying for Part B, you will be notified directly from Social Security in December about what income-related charges you'll pay in the coming year. They may differ from the current year. What is used each year is your tax return from 2 calendar years past. So for 2026, Social Security will be taking a look at 2024 returns and charging accordingly for Part B and for Part D. So if you're here today and you're currently enrolled in Medicare Part B and you have prescription drug coverage, keep in mind that it will be your 2024 modified adjusted gross income that Social Security will use to determine what you pay for your premiums in 2026, and they'll notify you of this in writing in the mail in December. Now, if you say, well, gosh, what's happening? I, had a life-changing event since 2024. I retired, or I lost my job, I lost my spouse, whatever the case may be. If you have a qualifying life event, there is a process for reducing that monthly premium so that you're paying something that more accurately reflects your current income in 2026. So that's something that either your Blue Heron team or we can advise you on if you'd like to reach out to us about that. All right, so those are where you'll learn about changes to Parts A and B and to what you're paying for Part B if you're on Medicare. And then for changes to Part C, Medicare Advantage plans, or Part D, prescription drug coverage, you are watching for, and this is again, if you're currently enrolled in a Part C Advantage plan or a Part D prescription drug plan, you are watching for something called the Annual Notice of Change, or ANOC. And this is a notice that you'll receive from your plan provider. So not directly from Social Security or Medicare, but from the insurance company that is your plan provider. And you should have received that by about this week. So it may still be coming. You may see it next week, but this is something that is to be sent and received in September per the Medicare guidelines. So if you have an Advantage plan or a Part C plan, or you have a Part D plan, if you have not seen this ANOC, you want to go back, check your mail again, and it could be that this is something that you are receiving online. If you receive electronic messaging from your plan, they are allowed to send this notice by electronic message. So you'll want to check either your portal or your email for this message. If you still can't find it, you'll have to reach out directly to member services for your plan and ask for them to send you a copy or to direct you to this notice on their website. But it is a very important document because it's this document that will summarize the changes in your current coverage, including changes in cost that will become effective on January 1st of the next year. Now, if in 2025 you are enrolled in a Part C plan or you're enrolled in a Part D plan, if you make no changes, that will be your plan as of January 1st. The only exception to that would be if you change your plan, then your current plan is canceled automatically. You'll be in a new plan. Or if your plan is ending, this notice is more important than ever. This notice will tell you if your plan is ending, and you'll automatically be enrolled in something new, because that is one possibility when plans leave a market. Or if your plan is ending and you are required to act to select a new plan. And that's another possibility. So it just depends on how that plan provider has contracted with Medicare, how you would proceed if your plan is ending. Again, going back to some of the impacts of higher healthcare costs and higher healthcare utilization, and the difficulty for these private insurers to continue to partner with Medicare. One of those impacts is the market is retracting a bit, and we are seeing fewer plans from 2024 into 2025, and most likely from 2025 into 2026. So fewer plans offered means that your chances of your plan ending are a little bit higher. So that's why it is so important to watch for this notice and make sure that this is not going to be something that's happening to you. So while we're on the screen, I want to go back and talk about what I was saying earlier, that right now our current clients were just in this flurry of email exchange where we've sent a lot of information out to them, just making sure that they know to touch bases with us over the next several weeks. And we're just hearing all of these great, updates, summer travels, and new grandkids, and all the fun stuff. And a lot of really nice messages saying what I shared earlier: my coverage is great. I don't have any changes to my health, and I don't anticipate making any changes. Again, our response back is hold on and let's still touch bases after October 1st. Because one of the things that can happen, again, is something really drastic. Either your plan is going away, and if you don't act, you won't have coverage in January, or your plan might have a massive increase in premium. And in a way, we've kind of described that like a quiet quitting. If this is a plan that is looking to get out of the market, one of the ways to do that is to take the premium, sky high and have people hopefully act to leave. But if you thought that you were happy and that no changes were going to occur and you missed this notice, you might also miss something like a drastic increase in the monthly premium. So our job with our current clients is to make sure that everyone holds off. Don't decide that you're all set for 2026 until you've checked this letter, you've made sure that your plan isn't changing drastically, and we've connected to make sure that there isn't something else that you might want to consider for next year. So super important notice. Unfortunately, from 2024 into 2025, there was a very, very common prescription drug plan where the the premium in most markets went from anywhere from $5 to $10 to as much as $50 in 1 year, and the coverage itself did not improve correspondingly. So for those clients who just were not watching for this update and touching bases, it was a shock in January and February and March when they started noticing that premium. So we hate to see anyone miss the way these changes can change, these plans can change drastically from 1 year to the next. All right, so for the annual enrollment period, what are the changes that you can make? Again, we're talking about October 15th through December 7th. What can you do and change about your current coverage going into January 1st of 2026? Well, if you are currently on a Part C or Medicare Advantage plan, you can take a look at all of the other Advantage plans in your market. And if you'd like to switch to a different one, this is the time to do that. You can change to a new Part C Medicare Advantage plan. Change number 2 is that if you have original Medicare, so A and B is your primary insurance, and you decide that you'd like to enroll in a Medicare Advantage plan, this is the enrollment period to do that. So you can switch to Medicare Advantage. If you are currently on a Medicare Advantage plan or a Part C plan, and you have decided that you'd prefer to go back to original Medicare A and B as your primary insurance, this is the time to exit that Medicare Advantage plan and go back to original Medicare. Now, we have a really important asterisk here, which is to say that if you leave a Medicare Advantage plan and you go back to original Medicare, you would really want to consider having secondary insurance to original Medicare, meaning you would really want to have a Medicare supplement or a Medigap plan working with original Medicare to protect you from runaway out-of-pocket costs. Unfortunately, going back to what I shared earlier, Medicare supplement plans are not guaranteed during this enrollment period, nor are they guaranteed throughout the year, except in very select circumstances. Typically, a change, as is described here, going from a Medicare Advantage plan to original Medicare and seeking to add a Medicare supplement is a change that would require medical underwriting. So your application would include health questions, and that insurance company would determine, number one, if they'd like to accept or decline your application for coverage, and two, if they do accept your application, how they want to rate you. And you can be rated up or declined for pre-existing conditions. So again, it's a change, a mindset shift. Ever since the Affordable Care Act, as a country, our brains have been trained to think of fall, open enrollment. My pre-existing conditions are all out the window, off the table, and I can get the coverage I want. That is only true for certain types of coverage, and it is not true for Medicare supplement plans. So all of that to say that this type of change, leaving an Advantage plan, going to original Medicare, is a change that should be done very cautiously so that you can be certain that you are able to secure Medicare supplement coverage to work with original Medicare. One of the things that you would do at the same time is you would add prescription drug coverage, and that is something you can do at this time of year. And speaking of prescription drug coverage, the very most common change at this time of year, at least with our clients, is a change from one prescription drug plan to another. Again, perfect example is a plan that you've had for maybe a year or more. Maybe it has a very low premium and it meets your needs precisely. That plan could look very similar next year, or it could be completely different. And you're going to be watching for that notice of change, that ANOC, so that you can see, will my premium be similar to what it was this year? Will it still cover the same medications that I'm taking and using? Will this plan have higher copays or coinsurance next year for the same medications? If you see a lot of changes, you'll want to switch to a different Part D plan. The way we like to describe selection of prescription drug coverage to our clients is you want to think of this as a math problem, and it's a math problem that you want to do 1 year at a time. So for 2025, you were taking certain prescriptions on a regular basis using a certain pharmacy or maybe two or three pharmacies, and you had plan choices and you wanted to choose the plan where your total cost was as low as possible for 2025. So by total cost, we mean all of the monthly premiums, the deductible if there was one, the copays on the medications, and the coinsurance, taking all of those amounts into one total amount. That's our math problem. We wanted our clients to be on the lowest total cost plan for 2025, and we're going to do the same math for 2026. And while you might be loving that current plan, it might not, the math might not work for next year. So it's something to pay attention to. Again, it's a math problem 1 year to the next. And don't be surprised if your plan changes drastically. They don't all change drastically every year, but when they do, you don't want to be caught not watching. And then finally, for those who did not select prescription drug coverage when they were first eligible, that is not something that you can add throughout the year. Many people are not aware of that. Sometimes we'll talk to people who maybe didn't work with us when they first transitioned to Medicare and they didn't select prescription drug coverage because they weren't taking anything. Unfortunately, that's a risky endeavor because something can come out of the blue throughout the year and you'll want prescription drug coverage, but you can actually only add it during the Medicare AEP. So this is the time where we try to make sure that those who missed it the first time around are choosing that drug coverage for 2026. All right. So what's new for 2026? So I mentioned earlier that I'd share what we have as current estimates for some of the key numbers in Medicare for 2026. And the first one is a pretty big jump. This is an 11% increase in the monthly premium from 2025. So the estimated Part B base premium, so this is without any income-related adjustments, the estimated monthly premium for Part B in 2026 is $206.50 per month. So this is per month per person. Again, it's an 11% increase, and we haven't seen an increase that high in a while. So we're not seeing those increasing costs only on the private side. We are seeing them directly from Medicare itself. Pretty big increase in the Part B annual deductible. Now, fortunately, it's still low relative to what we all get used to with employer plans or ACA plans. This year, that Part B annual deductible was $257. Next year, it's estimated to be $288. Part C annual maximum out of pocket. So again, Part C plans are what Medicare Advantage plans are, and they have a maximum out-of-pocket ceiling that is set by Medicare. They can come in at a lower maximum out-of-pocket and contract with Medicare for a lower maximum, but the top maximum out-of-pocket is set by Medicare each year, and next year that is going to be $9,250. Again, with the market contracting, healthcare costs and utilization rising, we'll probably see more plans that are closer to this top threshold than not. So that's an important number to be watching for. The Part D or prescription drug coverage deductible was $590 this year, and next year it will be $615. This is the maximum. Again, some plans may come in with a lower deductible. Of course, you'll see a higher premium associated with that, but this is the maximum deductible that a plan can have next year. Part D annual maximum out of pocket. This year, 2025, was the first time we ever had a maximum out of pocket on Part D. This year it was $2,000, and next year it will be $2,100. So you may spend $2,100 out of pocket, not counting your monthly premiums for that prescription drug coverage, $2,100 on deductible copays and coinsurance for your covered medications, keeping in mind that medications that are not covered by your plan will not count towards this $2,100. So unfortunately, we talk to people who are often filling expensive medications that their plan doesn't cover through a source in Canada or Europe, or maybe they're just paying out of pocket for something and they have the misimpression that it will count towards their maximum. And unfortunately, it's only covered medications. And one of the most common types of medications where we see people spending a lot out of pocket is on the very popular GLP-1 medications. There's been a lot of volatility in this class of medications in the last couple of years. As they were first coming out, we saw robust Medicare coverage for them. They rapidly became one of the largest costs to the entire Medicare program. And when that occurred, the Medicare program had to very abruptly scale back and say, hold on, we can no longer cover these for weight loss. We will cover these for diabetes, certain cardiovascular conditions, and obstructive sleep apnea, not just for weight loss. That's how we went into 2025. And then there are still some questions as to how well these medications will be covered in 2026. We'll be able to talk about that more and look at that more after October 1st. But it's a very hot topic. There are a lot of people spending out of pocket on these medications, and it just depends on the year. And honestly, it can depend on the month because we do see legislative changes throughout the calendar year, specifically surrounding these medications. They are one of the biggest line items for Medicare. So it's a very, very hot topic. Just a reminder, one of the Medicare prescription drug topics that was a huge deal for a couple of decades was the coverage gap, also known as the donut hole. And this was the coverage stage where someone who was taking a lot of medications or some costly medications would, throughout the year or at some point in the year, would hit that donut hole, and they would pay for more of the prescription costs during that donut hole. So their costs would really go up part of the way through the year. And it was startling, disrupting, disconcerting, all of the things. Nobody liked the donut hole. That was eliminated as of 2025. It is not coming back in 2026. So if you previously experienced it or had a friend or family member who experienced it and it just left a bad impression with you, it is no longer a part of the Part D program. So that's some good news for today. Okay, so finishing up with how Medicare or MP Group, we used to be Medicare Portal, MP Group, how we can help. So we can help with reviewing the annual notice of change and taking a look at how those changes may be significant. If you're looking at something and you think, I don't know what I'm looking at and how significant this may be, we're going to be pretty familiar with how plans are changing in the Mid-Atlantic market especially, but throughout those states that we showed you that we cover, and just helping you understand what else is out there. So unfortunately, in times where the Medicare market is really strained the way it is currently and going into the year ahead, we might be looking at something that you don't like the looks of and not necessarily able to improve upon it in terms of costs. But the good news is that if there is a way um, to find great coverage at a lesser cost, that's really what we do. So again, it's when appropriate. So if there is something available that is comparable or sufficient, suitable for your healthcare needs, we can make that selection and facilitate new enrollments in that coverage. And the goal is to just make sure that as well as possible, to make sure that your Medicare coverage meets your financial and medical needs. We don't like to see anyone make any changes to their coverage, um, quickly or without consultation. There are just a lot of things that we'd like to pro con with anyone that we have a chance to work with. There's some significant things that can happen that can limit your ability to undo a change that you might make. So again, we hate to see anyone do that just based on some of the marketing that you see, picking up the phone and calling an 800 number. We hate to see, because we've seen it, where that leads. And we just don't want anyone to make a decision that's going to jeopardize either their medical coverage or, their financial requirements or parameters. And again, I mentioned before how at our website, mpgroup.org, you'll find a lot of educational resources, videos, blogs, newsletters, webinars on all types of Medicare topics, and just ways to connect with us to find out more. So, going back to where we started, talking about all of that misinformation and really aggressive, confusing marketing that you may be starting to see and hear, and you certainly will see and hear more of in the weeks ahead. And if you're currently Medicare eligible or enrolled in Medicare, it's going to be in your mailbox, it's going to be in your inbox, it's going to be coming through by text. They just find us. It's out there. Just take away from today that you do not have to do anything during the Medicare annual enrollment period. If you'll be starting Medicare next year, this enrollment period does not apply to you. If you're currently enrolled in Medicare, you don't have to change your plans. They will remain your plans January 1st of 2026, but it is important to take a look at how your plans may be changing on you so that you're not caught by surprise. And then, of course, it goes without saying, if you see something, read something, hear something, and it sounds too good to be true, when it comes to Medicare, I can assure you that it is. Again, those advertisements are targeted towards a very, very small, limited demographic of individuals who qualify based on income limits. When you hear all of those goodies, those are the people who qualify for them. And that's just not something that's going to be widely available to the average Medicare recipient. Trusted resources, that's what it's all about. We love explaining things to people, helping them understand their coverage and what their choices are so much better. Going back to knowing more and stressing less, that's what it's all about. We just want to help you understand what we have seen, what we know, what you have coming in the year ahead, and helping you navigate your choices as well as possible, even in years where things can be a little challenging and costs are going up. the real truth is, the goodies that are out there is just the plan that's right for you based on who you are, where you live, your medical needs, your financial um, plan, and what we can help you find if a change is appropriate. And if there is no change required, we tell everyone to stay put. We just like to make sure that we're all just taking a look and watching for what's ahead. Okay, so again, questions can be sent along, if it's something retirement or Social Security related, certainly to Blue Heron. This is our contact information. This is my team at MP Group. You can contact us a variety of ways. This QR code will take you to our landing page. You can reach us by email or phone as well, and I'm happy to help however we can. If you are looking at enrolling in Medicare in 2026, depending on your timing, if you want to touch bases with us, if it's not something that needs to be addressed in the fall, we'll let you know what timing is best for the 2026 date that applies to you, and then we can reconnect then. So, Sarah, can you think of anything that I might have glossed over too quickly, or any question that's on your mind?
This was great. Such a meaty presentation, and we always learn so much from this. So I know that those are online also just get so much out of this. And as you said, demystifying some of the areas, especially heading into open enrollment and those that will be eligible, just getting bombarded with a lot of different language. So knowing, okay, what do I actually need to pay attention to? So thank you so much. And yes, some of those common questions that you touched on, we get those as well. I just had a conversation earlier this week with a couple, and their drug coverage is changing in the new year. So trying to figure out what all that looks like. But we so appreciate it. We know that this is your and heading into your busy season. So thank you for taking the time to educate all those on the call, including us, because we always learn something new. And again, for those on the call that maybe missed it in the beginning, certainly if there are general Medicare questions, we are happy to help. We can also pass those along to Emily, but as it relates to medical and figuring that into your full retirement picture or financial plan, please let us know. We are here as a resource if we are not already working together. We'd love to get some time scheduled just to go over what those questions might look like. So here is Jessie's contact information. Feel free to reach out to her as well, along with our website where you'll find our team there too. So thank you, Emily, very much.
Sure.
And again, we'll follow up with an email and some additional action items and resources. So please let us know if you have any questions as a follow-up.
Thanks.